Conventional wisdom. One guy on the TV says that there are 47 million Americans without insurance, and boom, that number is cast in stone with no discussion of whether or not it's the right number to use when we're talking about healthcare reform. Now, truth be told, it's a good number. It comes from the Census Bureau. They work with the Department of Labor Statistics, and they come up with something called the CPS. I think that stands for Current Population Survey. And they interview 50,000 households and ask them the question, did you have health insurance sometime during the last 18 months? My issue is, for people like me, taxpayers who are going to be asked, well, told, to help with the insurance costs for these 47 million people, do all 47 million people need assistance? For example, how many of the 47 million are actually already on some kind of government health care program like Medicaid or Medicare? Or how many of them are actually eligible for those programs? That number is about 10 million people. For whatever reason, they said no. I don't know, maybe they were embarrassed about being on Medicaid, but those people should not count as being uninsured. So, next question for the 37 million people who don't have insurance is how many of those people actually could afford health care insurance? And by that I mean they make more than 3 times the national poverty level, about 60 grand, and they're above the U.S. median income level. Should I be asked to help with the insurance payments for those people just because they prioritize health care differently than I do? I think the answer is no, and I don't think those people should be counted as non-insured. So, that's about 10 million people, so of the 27 million people who don't have health insurance, how many of those are adults with no children? Now, they could be financially at a financial disadvantage, but with limited resources, are those guys really first in line? And I'd say no, and that's another 5 million. And finally, how many of the total figure are not U.S. citizens? Now, I'm not going on some kind of anti-immigration nativist rant. I love immigrants, they're the lifeblood of this nation, and they make good food. But does coming here, legally or not, qualify you for taxpayer-assisted insurance? I'd say no, and that's about 9 million people. So the grand total is about 13 million. I don't think 13 million people justify a complete overhaul of our health system, which is what is being contemplated right now. And I don't think 13 million people justify another federal health program that's probably going to go bankrupt just like the other ones. What I do think we should do is get the cost down of health insurance. And how do we do that? All the stuff I've been talking about. Create a state-level health insurance exchange, tort reform, drug reimportation, revenue-neutral tax restructuring. Change the way Medicaid and Medicare reimburse medical providers. Beef up on anti-fraud measures. Watch the mandated benefits.